My name is Yahaira, and in this lesson, we will be talking about STIs. So, what are they? First of all, STI stands for sexually transmitted infection. They are also referred to as STDs, which are sexually transmitted diseases. STIs are transmitted when people have unprotected sex, or when people have unprotected sex with multiple sexual partners. This can put you at higher risk of contracting an STI. How do you know you have an STI? Well, some people don't experience any symptoms, but some of the most common symptoms include unusual discharge or odor, burning when urinating, pelvic pain, and new genital sores or skin changes. Some STDs can be cured with medications, and it is recommended that you see your healthcare provider immediately if you think you may have an STD. Some of the most common types of STIs are syphilis, chlamydia, gonorrhea, and the human papillomavirus, also known as HPV. Syphilis can be transmitted from person to person via vaginal, anal, or oral sex through direct contact with sores or lesions, also known as chancre. Chlamydia is also transmitted by having vaginal, anal, or oral sex with someone who has it. It is super common, and the infection is spread through semen, pre-ejaculate, and vaginal fluids. Currently, there is a cure for it. Gonorrhea is also transmitted by having vaginal, anal, or oral sex with someone who has it. It is actually very common, especially among young people ages 15 to 24, and it also has a cure. The human papillomavirus is the most common STI. You can get it by having vaginal, anal, or oral sex with someone who has it. It also spreads through close skin-to-skin touching during sex. There is no cure for HPV, but most HPV infections go away on their own and don't cause any health problems. If HPV does not go away, it can lead to health problems like genital warts. It can also cause certain kinds of cancer. HPV itself isn't cancer, but it can cause changes in the body that lead to cancer, which includes anal cancer, cervical cancer, and oropharyngeal cancer, which is cancer in the back of the throat, including the base of the tongue and tonsils. How can we prevent the spread of STIs? Well, latex barrier methods such as condoms and dental dams reduce the risk of getting an STD. A dental dam is a square piece of latex that is placed over the genitals when receiving oral sex. Another thing you can do is talk with your healthcare provider about receiving the HPV vaccine. Finally, it is suggested that you get tested each year if you're sexually active so that you can be treated for any STDs and lower your risk of long-term complications. The HPV vaccine is recommended by the CDC for those between the ages of 11 and 26. It is given in a series of shots, and it is very safe and effective. It helps protect you against certain types of HPV that can lead to cancer or genital warts. It has been monitored for over 15 years, and it gives long-lasting protection against HPV. What are some new things you just learned? Please write down some notes of this in the notes section of this app before moving on to the next video.